Hi, my name is Aaron. I am currently enrolled in Liberty University's Masters of Public Health program. For the practicum assignment, I had the opportunity to partner with Virginia Family Services, a mental home health agency in Richmond, Virginia. If you refer to the next slide, we'll get into the background on exactly what my assignment was. Mental health includes one's emotional, psychological, and social well-being. It also determines how one handles stress, how one relates to others, and how people make choices. The need for quality mental health care has increased significantly as 1 in 13 Americans 12 years and older is depressed, and individuals living below the poverty level were nearly 2.5 times more likely to have depression than those at or above the poverty level. Mental health care providers continuously assist on individual and community levels, and this type of care ensures that one reaches their full potential, copes with the stresses of life, works productively, and makes meaningful contributions to their communities. Considering the impact that these care providers have on the individual level, and because of this, it is vital that further study be completed to gain more in-depth understandings on how the work environment impacts community support specialists' nutritional habits. Virginia Family Services, as an in-home mental health care provider, caters to the needs of individuals throughout Central Virginia, South Virginia, and Richmond. Their missions is to provide quality care and treatment to individuals who need assistance with outpatient therapy, community-based rehabilitative services, developmental disability waiver services, addiction and recovery treatment. Their focus is to strengthen families by providing their highest quality of clinical and supportive services through family-centered therapeutic, educational, and training approaches. On the next slide, we focus on the girth of my assignment, which was the nutritional survey that I composed. During the study, a survey was provided to 22 community support specialists, and this was designed to identify levels of stress, knowledge of adequate nutritional habits, their access to healthy foods in or around the workplace, and to assess these potential risk factors' overall impact on nutritional health. In addition to identification of potential risk factors, this study also highlighted race, ethnicity, body mass index, amounts of fast food consumption, barriers of healthy eating habits in the workplace, and developed a comprehensive plan that provides recommendations for adequate nutritional intake for all body types, which include underweight, average weight, overweight, and obese. Lastly, the survey also provided employees the opportunity to share whether or not they were willing to participate in a health promotion program. Upon completion of this study, the goal was to gain a more in-depth understanding on how stress, nutritional knowledge, and access to healthy foods contribute to nutritional habits while actively working in mental health environments. On the next slide, we get a more in-depth understanding of the nutritional assessment. So we started off with the BMI. Study participants were asked to report weight and height in an open-ended response format for body mass index calculations. Body mass index was calculated per individual to determine their weight category. Underweight, average weight, and overweight and obese were all accounted for. The goal was to utilize BMI scores to create a diet regimen that is well suited for all 4 classes, assuming that all groups participate in little to moderate physical activity on a regular basis. Responses were scored on several scales depending on the questions that were being asked. All questions administered in this survey can be found in this section. My knowledge of healthy eating is, with responses on a 5-point scale from very low to very high to unsure. How healthy do you eat during work hours, with responses on a 4-point scale ranging from very unhealthy to very healthy. And then there were stress-related questions which address stress in the mental health work environment and the potential impact or level of influence that stress-related factors may have on eating habits. The questions are as follows. I feel my job impacts my eating habits, and I have time to eat during work hours. Both questions were scored on a 5-point scale from never to daily. This study highlights factors related to the nutritional habits and body mass index. These findings were consistent with results from similar studies among hospital nurses with similar work habits to community support specialists. The mental health environment and other health-related work environments have been viewed as a barrier to poor nutritional habits. However, the majority of community support specialists responded positively to the idea of workplace health promotion and played a significant role in offering suggestions that would aid in improving nutritional habits in their specific work environment. On the next slide, we focus on the results. 92% of community support specialists participated in unhealthy eating behaviors, such as eating fast food and other forms of junk food on a regular basis. An external factor that may affect eating behavior opens when the food supply or the number, density, and variety of food outlets in an individual surrounding or food environment is examined. For example, areas with a higher density of fast food outlets have been associated with higher levels of fast food consumption. Individuals living in these areas are almost twice as likely to develop obesity than those who live in areas with fewer fast food restaurants. Areas with higher density or fruit and vegetable outlets and supermarkets, on the other hand, are associated with higher fruit and vegetable consumption that lower prevalence of overweight and obesity. Community support specialists are intentionally indulging in unhealthy nutritional behavior, fully understanding that those behaviors are unhealthy, and it is believed that community support specialists intentionally indulge in these unhealthy eating behaviors because it is faster than meal preparation, easier to access versus healthy foods, and fast food is generally more appealing. Results suggest community support specialists are intentionally choosing to make unwise decisions concerning the nutritional habits while working with mental health clients. This evidence is supported by the fact that 82% of individuals reported having ample amount of time to partake in meals while on assignment. 68% of individuals reported having access to healthy foods either in or around the workplace. However, these individuals chose to partake in the unhealthier food options, while 68% of community support specialists reported that their job had a direct impact on healthy nutritional habits. And this in part could be linked to stress levels while working with mental health clients. The next slide shows recommendations. 40.9% of community support specialists suggest that meal prep would help aid in healthier eating habits during work hours, while 27.3% suggest that access to nutritional programs and access to healthy foods would aid in healthier eating habits during work hours. According to the National Independent Health Club Association, one of the best ways to simplify one's healthy eating goals is by meal prepping. Meal prepping typically involves dedicating at least one day a week to preparing enough meals to sustain for the week. In conclusion, the mental health work environment appears to have some influence on the nutritional habits of community support specialists. Evidence from this study has highlighted that environmental factors are very likely to be associated with individuals who are either overweight or obese on an international scale. Although community support specialists appear to have access to healthy food options based off of their responses to the nutritional survey, they intentionally chose to eat fast food and other unhealthy food items on a regular basis. Work-related stress is the leading workplace health problem and a major occupational health risk. With this in mind, it is vital that Virginia Family Services continues to get to know the community support specialist work environment from a first-person perspective. As Virginia Family Services continues to study and fully understand its workers and the extent of their stress factors, an action plan can then be created and implemented that is tailored towards improving poor nutritional habits and other health-related risk factors. Effective workplace programs and policies can reduce health risk and improve quality of life for United States workers, including Virginia Family Service Community Support Specialists. That is my practicum assignment. Thank you.